All right. I want to welcome the leadership of Greater Washington to our PNC Place here, our headquarters here in Washington, D.C. We are the proud sponsor of Lessons in Leadership, which we've been doing for at least 10 plus years, maybe 20, since the beginnings of us being here in Market. And it's been a little while, Marty. We've not done this in a little while because in January and February that the weather was actually awful.
Wow.
So we're happy to be back here in May, but we waited, of course, to have the best target that we could have, which is the reason why we waited as long as we did. And we also waited because today is our return to office for PNC Bank. Today is, which you would not imagine, it's 2026, and today is our first return to office. So I'm going to start before we jump into our interview questions here. Tell me about your return to office at Accenture.
Okay.
When do you actually have return to office? 800,000 employees around the world, and what does that felt like?
Well, first, I wanted to start, Jermaine. As was mentioned, you guys are great leaders across the community, and everywhere that is anywhere that anybody should be, PNC is it. And so I thought I'd start with, whether or not he wanted to make this. I picked these up at multiple events. I have about 10 of these now, so I just thought maybe you might want one.
I had 3 minutes before I came in, but I'll take another just to say, because it melted already.
I know, but it also makes sure that they see the logo. Yeah. So it's pretty to start there.
So who's doing the interview today, me or you?
It might feel a little bit of both. So in terms of return to work, return to office, I think a few things that I would say about that. First about Accenture, but also more broadly about DC and DC writ large. So we are, obviously in terms of Accenture, for folks that may not know, we are largely a technology company. We do many other things, but have our roots as being a technology organization. Return to office and return to work has been particularly difficult. We've seen some of our larger alliance partners and some of the folks that we work with, as well as some of our competitors, trying to navigate how exactly do you do return to office once folks got used to not being in the office. And in particular, for folks that are technology based, they have even a more sense of freedom and expectation of that freedom, especially as they are choosing their jobs and choosing whether or not to stay employed with certain companies. So, Jermaine, to your question, we have been trying to navigate this. We've been slowly but surely moving back to having conversations with our people about the importance of being in the office, why you should be there, why in particular for a consulting firm, it's important to have and be apprenticed, to be around leaders, to be around folks that, especially as you're trying to get staffed, might be able to kind of look left, see you and staff you, and for your own career growth and the accelerated growth of your career. What we have encouraged our people to think about and the rising expectation on them is to say, hey, we would like you to be in the office or at the client site 3 days a week. Now that's a goal. It hasn't been rigorously enforced, but that's where we're moving and where we have been trying to move. We have also gone about the process of looking across our real estate portfolio and where appropriate, making sure that we are optimizing that portfolio and making sure that it is all of our locations are places that people want to come back to work. That has we've changed a lot of our personnel there and made them more hospitality professionals, so that if you have a chance to go to our 699 Bank building or our 1201 Wilson building or our Glebe office or our 1201 New York office, we've got 4 major facilities around here, you will feel a sense of welcome, you'll feel a sense of belonging, you'll feel a sense of folks that are trying to delight you every day and make your both health and wellness a priority for them and your day a priority for them. So that's how we're going about it. We haven't gone with any hard mandates. We haven't, which you've seen some high profile ones in the paper. We haven't gone there, but we are trying to encourage more return to office and more folks wanting to come back. The other thing we've done, last thing that I would underscore is we have tried to have all of our events in our office themselves. So, trying to get our ERG events, our community events, our training events, our social events all back in the office. so that it gives people more of a reason to come back.
Sure.
So last thing, I'm sorry, I should have mentioned on DC. So in DC, right, our foot traffic compared to pre-COVID levels is still down. That has a really challenging effect on our local businesses. And so the more folks that we can get more folks back to the office, the better, and need to try to continue that. It's not as bad as it was, definitely improving. Tourism is also slowly coming back, but we need that foot traffic for a lot of our local businesses.
Yeah, my 30 years in the industry, this is probably the most difficult I've had to, in terms of managing exactly where our expectations are around our people, and even for ourselves in terms of how we show up and how we show some leadership amongst our workforce. And so I appreciate you giving us a little bit of insight as to how you're dealing with it at Accenture. So before we go into your professional life at Accenture, I wanted to talk a little bit about you personally. Can you tell us where you're from?
I am from Philadelphia, America's city, birthplace of democracy, Alba Frida. Not that I'm biased in any way. We recently beat the Celtics, but
All right. So that was a big one. I thought they were going to lose. Actually, they were down 3-1. They came back.
Keep believing.
All right.
Trust the process.
Think Embiid can stay healthy throughout the entire series.
I'm just taking a game at a time.
Okay.
So we're good. Yep. That's like a metaphor for broader life, folks. With all the craziness in this world,
Stay in the game.
take it a day at a time, stay in the game.
All right. So grew up in
And
Philadelphia.
stay healthy, mentally and physically.
So grew up in Philadelphia. Spent your high school years in Philly.
Yep, went to St. Joe's Prep, Mayon de Gloria,
Any
Jesuit school.
Jesuit school.
Yeah.
And do you have any siblings?
3 siblings, all older, so yes, you can tell I'm the youngest child.
Oh wow. We don't hear that a lot.
Yeah.
We actually start with the oldest typically and get to the youngest, but you're youngest in the family.
Correct.
So tell me a little bit about your siblings.
Tell you about my siblings.
And your parents.
Oh no, my parents. That's much.
Okay, is that
that's,
easier?
That's a much cooler conversation. Just like this is being taped. If I said something nice about my siblings and make it back to me, I mean that's all.
Well, you don't have to talk about all 3. You can just talk about maybe 1 or 2.
Yeah. Well, we're gonna do the parents. All right, we'll say the parents. Okay. So, folks, I have been blessed with the most amazing parents ever in the history of mankind. I can't. Well, my dad's passed. He passed roughly 18 years ago now. But I still think about him every day. I still talk to him every day. I probably talk to him more now than I did when he was alive. Most amazing guy. When people tell me, when I'm back home, I'll still walk around and people say, "Oh, you must be Dr. Rodgers' son," right? And that is like the highest compliment that anyone could give me. Because he was just an extraordinary guy. My dad was a old school family doctor. He had a unbelievably hard childhood. His mother left the family at a very young age. His dad was African American. His mom was Hispanic, from Colombia, and he raised largely by boarding schools. And he went off to Notre Dame and became one of the first African Americans to go to the University of Notre Dame, which is where I would eventually go. And then he came back to Philadelphia. He went to Temple Med School. He was supposed to go, Jermaine, and work at the same black hospital called Mercy Douglas, where his father had worked. And out of the blue, he got a call. And that call was from a nun in the suburbs of Philadelphia, a place called Norristown, Pennsylvania. And that nun had heard about a African-American kid who had gone to Notre Dame. So if he went to Notre Dame, it had to be okay. And so she interviewed him and decided, after interviewing him and meeting him, that he had the right personality, tone, and temperament, that she would choose him to desegregate the hospitals in the suburbs of Philadelphia. So he went and got visiting privileges at Sacred Heart Hospital in Philadelphia. And at the time, if you were a African-American doctor and you had African-American patients, when your patients needed you most, you could not serve them because you did not have visiting privileges at hospitals. So she was going to break that. And she did. And then the hospital right across the street, which was a public hospital, was so shamed by that they gave him visiting privileges as well. And so my dad was the first African American to integrate the hospitals in the suburbs of Philly, with all that you can imagine attendant to that, and the challenge and the hardship of that. But it is also one of those things that goes to the point of whether it's Notre Dame or it's those hospitals or otherwise, that once you are inclusive, it makes a material difference in your outcomes and business performance. My dad would go on to found and to run the top residency program in the entire state of Pennsylvania and eventually the entire country at Montgomery Hospital, that didn't let black folks be on the board have visiting privileges. And he would run that program for 40 years, and it would be associated with Temple Medical School, and he'd be one of 2 black faculty members at Temple Med School, where he would grad.
Now I see why you talk about your death. It's a great story. So I was expecting when I asked you about Notre Dame that it was potentially a mission-driven, potentially a religious-driven pursuit for you. Many of our kids today, when they're looking to go off to college, they're talking about sports. Like I probably back in 1988, I think when you graduated from Notre Dame, may have gone to school for Lou Holtz, but it sounds like it was more about purpose than personal.
Yeah, well, my dad is from there, so he was
so
sort of
there's
encouraging that. I was not as lucky with my son, but yes. But my daughter is about to graduate this in a couple of weeks from nursery.
Congratulations.
Thank you, Zora. That was awesome. So it was very much. My dad had been there. I had kind of grown up with Notre Dame, etc. The other advantage is I didn't talk about my mom. My mom is from South Bend, and so that's where they met. My quick story about my mom, who's still alive at 95 and will be joining us out in South Bend shortly. She was so her dad had a house that was right near Notre Dame. He would have the handful of young African Americans that were there, because there weren't obviously many folks there that were African American. He would welcome them to his house, Jermaine, and he thought they were coming because he was this big time guy in South Bend, right? He had been the first black police officer, and then he had been a player, coach, and owner of the Negro League. And the important things to remember about the Negro League teams is they weren't just about baseball, they were businesses, right? And so here was this guy who only had a 4th grade education, and he was playing, coaching, and owning a team that would travel throughout the South. And we didn't have the same level of phones, and be able to coordinate what we would call supply chain management now, and where you were going to be, and all the logistics, and as you would go to different games and all of that, right? And still make this a thriving enterprise. So long story short, he thought it was because he was, the man and so popular. But in point of fact, he actually had 3 beautiful daughters, and that's why the guy was attending from campus. And so that's where they met and fell in love. And so, long story short, I wasn't sold on Notre Dame, but I still decided to go for my mom and my dad. Another really, really quick story. I was going to transfer. So first year was miserable. I had come for a cell weekend. I was like, hey, this is awesome. This is great. But when I showed up on campus, I was like, where did all the black and brown people go? And we have had the worst recruiting year in the history for a long time, for Notre Dame. And most of the African Americans that were there were here full-time doing scores. So I was kind of miserable and was ready to transfer. And long story short, I went home, told my dad I was going to transfer. He said, yeah, not so much. And he said, you have to give it at least another semester, we'll talk. And his words of advice at the time were, you're either part of the solution or you're part of the problem. And so I very quickly went back and took that to heart, and I wrote this op-ed in the paper. And I was just a freshman, so freshmen think they know everything, so I was a little strident, it was a little over the top, but I thought it was pretty well balanced. It had facts and figures and what we could do to improve admissions and all this type of stuff. But it took on the president of the university, and the president of the university was a legendary civil rights leader, a guy named Father Hesper. So I go into the cafeteria, and everybody has this newspaper open, everybody reading its article. And I had dropped off the article the night before, but I didn't title it. So the editor titled it, and it said in bold letters, Father Hesper's commitment to civil rights has waned. And I thought, my dad is gonna get me. Like, I am toast, this is over. They're gonna throw me out of school, like this is just bad. So I eat my lunch and I go back to the dorm, and the phone rings, because we had the old, phones back then.
Yeah.
And my roommate says, I think this is for you. And it was Father Ted's office. And I'm like, wow, these guys are really efficient at dropping out of school. And sure enough, it was Father Ted's office. But the guy on the other end of the line said, Father Ted read the article. If you think you can do better, there's a job waiting for you in admissions. And so I go over to admissions. They have no idea what I'm talking about. I make some calls, and sure enough, Father Ted had created this position, and we went from my class was 3% minority representation, and the last class I recruited was 21%.
So you're on the board in that.
On the board there now.
Yeah. And are you continuing to fight that fight? And what progress do you think you've continued to make around admissions and just maybe a broader representation?
I'm a firm believer that when we are inclusive, when people have a sense of belonging, when they have a sense of when they feel seen, when they feel safe, when they feel connected, that's when they can be courageous and they can best lead. And so I still believe that and still advocate for that, and I do that in everything I do, because it's part of who I am, it's part of my story, it's part of my journey. I mentioned kind of both sides of my family, right? And at the end of the day, right, for me, the story ultimately begins, you asked me about my parents, but the story for me ultimately begins with two individuals whose last names we don't know, but whose first names were Amar and Tab. And Amar and Tab came on a slave ship called the Doddington, and they arrived in Yorktown, not so far from here, in 1735, on June 17th, if I remember correctly. On June 17th, if I remember correctly. I'm just gonna go like that from now on.
Can everyone hear okay? If now okay? Okay.
And the reason I raise that, right, is one, it's close. Two, it's to remind people that despite what might be said now, we've been American longer than anybody else, or lots of other folks. So at least we've been here a lot longer. And our blood and our sweat and our tears have mixed with the soil a lot longer than others. And so to deny our experience, or to deny our ability to go, seems ultimately hypocritical to what we say we stand for. And so that ship, the Doddington, if you look at the ship manifest, Jermaine, it's particularly, you can tell whoever filled it out was particularly proud, because it says, hey, there wasn't an insurrection, hey, we weren't captured or overrun, and oh, by the way, Captain Copeland, oh, by the way, we started out with 188 souls and 167 mate. And that was a really good ratio of how many people survived the journey. And so those slaves were a mother and a daughter. And they survived that journey. And the mother and daughter would be separated. And one would go to a plantation. Originally, they both went to a plantation named Blackwell, and then the daughter would go to a plantation named after Rodgers, Rogers. And the reason I underscore that along with my parents, right, is those are folks that endured so that I can endeavor. They endured hell on earth so that I can endeavor now. and all the challenges that we face in the broader society and otherwise, like, compared to that, it's pretty easy, right? And we just always have to remember that as we go on our journey. Like, this struggle's been a long one. Regretfully, it's going to get longer, but we have to remember that we've got to stay engaged in the struggle.
Well, I'm not sure that most of us thought we were getting a history lesson this morning.
Sorry, my bad.
But no.
We can go wherever we want.
No, much appreciated. And I wonder how that history grounded you in your next pursuits, which was to go to grad school. You clearly went to Notre Dame as a result of your dad. There was some legacy there. Any legacy at Harvard in your pursuits there? Or was that just an independent pursuit that you took on your own?
We'll get to, so in terms of Harvard, the great thing about Harvard was I finally got to grad school. I kept promising my dad I would go to grad school, and he kept being very dubious that would ever happen. So I came out of Notre Dame, and I was going to go immediately to grad school. And so that's part of the reason he thought that this was never going to happen. And instead, a company, Aetna Life and Casualty, convinced me to come work for them and then stay with them, and then...
So this is not in your bio. So which company you go work for?
I went to work for Aetna Life and Casualty up in Hartford, Connecticut.
All right.
Again, I was going to go directly on to a JD MBA at the University of Michigan, which is a whole separate story. And instead, they convinced me, they said, hey, because I wasn't going to interview with any companies, and they kept saying, please just come be our intern for the summer. We don't care if you go to school, but we want you just to come be an intern. And I said, okay, I'll do it. And then they said, well, if you're going to do business school, you should work and get some real experience. And I said, okay, I'll do that. What do you want me to do? And they're like, you tell us what you want to do. And so that was kind of my journey at Aetna. And then during, things just happen, right? And I always say, I came to DC to work for my heroes and my sheroes. And so because of that work, I was doing it in missions. Father Hesburgh nominated me and got me appointed to be the student representative on the college board, the SAT people. So I was on their board, and I'm going to my last meeting of the college board, and I'm down here in DC, and I'm very excited because it's my first time in DC without my parents. And I'm like, whoa, I'm big time. I got my own hotel room. I'm going to be on a panel, and all this stuff is cool, and this is great. And it was at the Grand Hyatt, not so far from here. Yeah. So, and Aetna had these amazing, I don't know if they still do. I presume they might still do it, but who knows? They might have had to stop it with DEI stuff. Who knows? But anyway, they used to have these unbelievably great Black History calendars. So, I'm doing my thing, networking, getting to, doing my thing at Aetna. And I have 1,000 calendars shipped down to the Grand Hyatt. Not the brightest bulb in the plant. I hadn't really thought about what does 1,000 calendars look like for this conference. And there's a big plenary lunch, and the calendars are there. And so I'm like, how am I going to get them into the lunch? And so I tip a couple of the guys to help me out, and they're bringing crates, and we're opening boxes as fast as we can, and people are pouring into the plenary lunch, and we're handing them out, and we're just throwing them at people. And they all go in, and folks go to sit. And they introduce a woman named Marion Wright Edelman to speak as the keynote. And I had never heard of her. I'm embarrassed to say I had never heard of her. And they give her a standing ovation before she starts. And I'm like, whoa, who the hell gets a standing ovation before you start? What's up with that? And then she spoke, and she got another standing ovation. And I never go up to speakers afterwards because I don't want to be like a groupie, but I went up to her afterwards and I said, I don't know where, I don't know when, I don't know how, but you're going to hear from me again. And turns out a couple months later, I'm working for her, and I get the job with her, and I defer grad school again, and work for her as her assistant. And she's at the time, the world's leading children's advocate, the nation's leading children's advocate, an amazing, remarkable woman of grace. She's got lots of books if you ever choose to read them and follow them. And she's she was recently installed at the National Portrait Gallery, if you get a chance to see her photo there. Anyway, long story short, I get the Hill bug then, and one of my heroes wins his election. And it's a guy named Senator Harris Wofford from Pennsylvania, my home state. I'm from Philadelphia. And he had been somebody, if you ever read Parting the Waters,
he has a whole chapter dedicated to him for the call that changed the world. And that's a much longer story. We'll tell it some other time. But this is also a remarkable man of grace who co-founded the Peace Corps, was a friend of Dr. King's from the very, very start of the civil rights movement, and had urged that Gandhian nonviolence could and should be applied to the civil rights movement. He had helped to create the first apprenticeship programs, the first national service programs. He'd been a college president, like everything a senator should be. And so went to work for him, luckily got a job with him, and worked on national and community service, worked for him for 4 years. And we did the first apprenticeship legislation. We did the first, we created the AmeriCorps program. We also wrote a bill with John Lewis to create the Martin Luther King holiday as a national day of service. So I got to work with John Lewis as well. Then I felt hypocritical, Jermaine, because I never served after spending 4 years talking about the importance of service. And so I went and served Native American kids in New Mexico. And then I went to the shell shock of Harvard Business School. I had gone from, unlike my classmates, and most of my classmates, I was making $300 a month doing service work with Native American kids in Gallup, New Mexico. And that's when I showed up at business school. Yeah.
So I have a feeling you're going to have a number of groupies after today's conversation, by the way. So don't feel bad if you want to come and talk to Marty after this talk.
No worries.
So give me some time frame, because I got lost there.
Sorry.
Yeah, no, it's okay. Because I wasn't sure if AmeriCorps and the National Day of Service for the Martin Luther King Day, if that was before or after grad school. It sounds like it was before.
Yeah, that was before grad school, and then also did that service work itself, and then went to grad school. All of those things were amazing journeys, right? We had White House signing ceremonies for all three. One of the things I would leave with the audience from John Lewis, we would always be down because we never thought we'd get this bill passed, because there was a senator from North Carolina, a guy named Jesse Helms, and his whole life, all he could do was figure out, like, he was a segregationist and was always trying to block anything and everything, including anything and everything to do with Martin Luther King. And senators are very powerful, so he would block everything, every attempt we had to get this bill passed. And we would be down and frustrated, and it's like a teeny tiny bill that doesn't, like, just should have passed by voice vote, right? Anyway, he would block it all the time, and we'd always get frustrated. And one of the things John Lewis said in one of our times when we were going to have to push the bill out a whole nother year is, he said, leadership requires a constancy of hope and a consistency of optimism. And I've always taken that with me, constancy of hope and a consistency of optimism. So hopefully all of you take that with you on your journeys, that if you're in this room and you're part of this thing, what's that stand for? LGW?
Yes, leadership.
Oh, leadership.
Yes,
there you go.
leadership, yes.
If you're a leader and you're part of LGW, then you got to have that constancy of hope and consistency of optimism, because that's how we define leadership.
So you clearly had a hole in the grasp on the type of leader that you wanted to be well before you pursued going to Harvard and ultimately landing at Accenture. I'm curious at what point you made the flip. Like, so your dad, when you go to grad school, mission and purpose was certainly really important for you. Like, how did that intertwine with what you were doing at Harvard and ultimately landing at Accenture?
Yeah, so closing the deal on my dad. So my dad had kind of given up on me going to grad school, right? And especially after I told him I was going to go do service work in New Mexico. He's like, oh, this kid's lost. He doesn't know what he's doing. So I'm home, and before I go out to New Mexico, or maybe I was home for break from New Mexico or something, I don't really remember, but he calls me aside, and it's one of these things, Jermaine, where, I'm old by this point, right? And my dad pulls me aside, and he's like, I've been meaning to talk to you about something.
So what's old? How old are you?
I don't even know. I'd have to calculate.
Okay.
Let me do that. Well, let me do that while I'm processing. So anyway, my dad says, hey, I've been meaning to talk to you. Your mom wants me to talk to you about this. And I'm like, oh my God, my dad is being told to talk to me about something by my mom. I must really be in trouble. Or worse yet, he's going to tell me about the birds and the bees. And so he says, you've been out of school for a while, and son, you started at Aetna, you went to work for the Children's Defense Fund, then you went to work on the Hill, then now you're going to do this service job, and your salary keeps going down, and it's supposed to be going up. And I don't know if you know that or not, but like your mom and I want you to know you're not moving back home.
I've had that talk. Yes.
Yeah. And
I hope I don't have that with my kids, but I did have that talk with my parents.
Yeah. So that was the
push.
That was the push. And so then I said, no, Dad, I am going to go to grad school, and finally went to grad school. In grad school, God, so many stories. In grad school, most important thing about grad school is I met my wife here in DC, who happened to be going to grad school with me, but I didn't know that. And then the rest of that is history. And we don't have time for that story in detail, plus it's embarrassing, so we'll skip that. But the other part of that is, some people graduate magna cum laude and all that type of stuff. I graduated, oh, thank you, Lordy. So that was neat. I have no idea how I survived first semester, first year. I had no earthly idea what these people were talking about. They were talking like now I know it's called consulting speak. That's what they were talking in, and Wall Street speak. I had no idea what they were saying. And so I survived that first semester, go home for break, come back. And when I come back, again, tells you how old I am, they had cubby holes, and there was a pink slip in my cubby hole. And I'm like, what the heck is that? And I pull it out, and it's the career and placement office. And career and placement office is asking me to come schedule an appointment and come to meet them. And when you're a first year at Harvard Business School, in your first semester, companies are not allowed to talk to you because they want to beat the crap out of you. The school does, and kind of survival of the fittest and all that good type of stuff. And so no outside communications, and not till second semester can you talk to anybody. So the first day that everybody's allowed to talk to you, they not only talk to you, they interview you, and they want to give you jobs. And so it's called Hell Weekend. And you'll have anywhere from 10 to 15 to 20 interviews, especially if you're clueless and unfocused as I was. And so I get this call into career and placement. I go to the Harvard Career and Placement Center, and there's two folks, not just one, there's two folks waiting to meet with me. And they're like, hey, so how are things going? And what do you want to do? And all this other type of stuff. And very quickly, Jermaine, how you're sensing the conversation isn't really about what the conversation's about. And what I quickly deduced is they were worried I was going to lower their hiring statistic and affect their bonus if I didn't get a job. So I was one of the people they were worried wasn't going to get a job. So they were like, so I'm like, yeah, I'm going to interview with iBanks, and I'm going to interview, everything's great. I'm going to try product management and brand management, and and they're like, you really should try consultant. And I'm like, yeah, but every time I talk to my classmates, nobody can describe what consultants actually do. So, why would I want to do that? And they're like, no, trust me, you have the type of background that consulting might like. Yes. So they're fishing, right? And I'm like, okay, great. If you think I should try consulting, I will try consulting. And that was kind of that's what they were after, was they didn't think I was going to get a job anywhere else. Maybe I could get something in consulting. So I stand up to leave. And you know how you stand up to leave, but you can tell people are talking behind your back? So I turn back around, and you can tell they're looking at each other. And finally the lady says, oh yeah. And one more thing. If, next week you're going to, interview, or next month you're going to interview with all these companies, you might really want to think about shaving your beard. Now, I had grown the beard because I looked too young on Capitol Hill, and I was trying to look, like I had more gravitas because I wasn't getting any respect on Capitol Hill. And so I'm like, yeah, okay, well, I said, well, respectfully, I appreciate that, but just so you know, my beard, it's not about me, it's more of a litmus test for them. And if they don't like my beard, there's going to be a hell of a lot of other things they're not going to like about me. So that was that. A week or two later, there's a first career fair that we can attend. And again, I'm not the brightest bulb in the plant. First company is Alcoa. The second is Anderson Consulting. They have consulting in their name. I go up to the table, I say, hey, I'm supposed to talk to you guys. And Anderson Consulting's now Accenture, and there you go.
So you landed Anderson Consulting in 1997, went through his problems in the early 2000s. Talk to us, so why the consulting business, and tell us a little bit about where Anderson Consulting was back then and where it is today in terms of Accenture.
So I chose consulting ultimately because I loved all the people I met during the interview process. And
by the way, the fact that they didn't think you were the sharpest tool in the shed, you ended up, so 7 years from joining the company and becoming managing director with the company. So
Right.
something worked out right.
something worked out. Yeah, better to be lucky than good, my friend. So I had I came in, I did an internship with them between my first and second year. I had an amazing mentor, a guy named Bill Copacino, who was also an HBS grad. And I started in financial services. I loved the work. Between starting and as I was about to start and going up to graduation, my dad had a stroke while driving the car up to Boston. And so I had to switch and change everything because I was the youngest kid, and I had to go and be in Philadelphia because I was the only one that wasn't married and out of the house. And so I did that, and I needed to be in Philadelphia, not DC, and I needed to also tell this company that, hey, I know I signed up to work with you guys, but I can't travel because I got to take care of my dad and help my mom take care of my dad. And I thought for sure, Jermaine, they would just fire me and just let me go, like, because a consultant had to travel and I couldn't travel. And I needed to be able to help get my dad to work and or pick him up from work and or get him to doctor appointments and all the rest. And Accenture was just like, yeah, just don't worry about it. We'll figure it out. And they got me, that fast 7-year journey to partner.
Yeah.
My first job, I was officially the file boy. And it was with an insurance company in Philadelphia, because I'd worked in insurance before. And it was that company, my client, who I still talk to today, a woman named Laura Garzell, still calls me her file boy from Harvard. And I was thrilled with it because it's one of those things where any job is what you make it. And so I was thrilled that I wasn't being fired. I was thrilled that I got a chance. Yes, did I want to be filing because I thought I was going to set the world on fire? No. Did I want to be filing after White House signing ceremonies and all this other stuff? No. But I had a job, and it allowed me to take care of my dad.
So it sounds like they got past the litmus test. They got past the beard.
Oh yeah, that's a whole different story. But yes.
And they were going to maintain you beyond the fact that you can travel.
Correct.
Was that part of the culture of Accenture?
Yeah, that's definitely part of the culture of the place. And it's something that I've kept with me in my leadership style ever since, Jermaine. Like, our first rule in all the parts of the business I've run is, and all my leaders can repeat it, family and health first, period, full stop, always. Family and health first, period, full stop, always, right? Like, if you're in question about whatever our other priorities are, go back to that first one. And it's because of that, right, that they found a way for me to stay engaged and not let me go. And then the other part of that is any job is what you make of it. And so as the file boy, I filed the hell out of those files, and so I did whatever was required. And we have people that come up to us all the time. You probably have a similar experience, Jermaine. It's like, well, what role do I have to do in order to get promoted? And will this role get me promoted? Because maybe I'll turn it down, and maybe I won't do this, and maybe that's whatever. And in this particular case, right, like, what I quickly found out was a few things. One, our folks and the clients were reading these files all day, and then they had to compare what they learned from the files. And then after they did that, they got to take a break. So they'd be reading for 2 and 3 hours at a time. They'd have this discussion, file their joint note, their independent notes, and then their joint notes, and then they'd bring it to me in the file room. And then they wanted to take a break, and then they wanted to not go back to reading files. And so I got to know personally the clients better than any of my other teammates. And I knew everything about that foot. I knew who was getting promoted. I knew who was sleeping with whom. I knew I got invited to their parties, right? Like, I was just the non-threatening file board, right?
So that Capitol Hill experience really came into play.
I don't know about that.
Yeah.
But all I'm going to say is,
There's a lot going on with Capitol Hill.
when we sold the extra work, when we sold the next phase of work, I was the first person they asked for, right? And that matters. And so then all of a sudden, I was helping lead those teams that were doing reviews versus doing the filing, right? And again, that really matters in terms of your trajectory in the career, is whether or not you're part of selling additional work and whether or not you're part of growing additional work.
Sure. So tell us about your role today. What's your title?
Yeah.
And how many people do you manage today?
So my official title is I'm the head of U.S. Health and Public Service, which for us is payers or insurers, providers, hospital systems, and public health, so Medicaid, but also some of the other federal health programs that are administered at the state level, like the rural health program, as well as the things like the health information exchanges, et cetera. So that's on the health side, and then on the public sector side, I have state, city, and county governments. I have K-12 and higher ed, and then a nonprofit social sector, and some of the quasi-governmental groups like UN and World Bank in those types of groups. So that's my day job, and both the sales and the delivery of all of our work at those clients. And then in addition to that, to your question, I have about 7,000 people that are part of our doing work at our health and public service clients right now, and then we have a much larger number of folks that are serving those clients offshore as well.
Congratulations, that's fantastic.
Awesome.
So 7,000 people. I mean, anything healthcare. I want to talk a little bit about healthcare, and then I'm going to turn it over to the crowd here, our audience.
Healthcare is so easy, folks.
Wow.
It's not complicated at all. Piece of cake, yeah.
But you're the right guy at the right time. Complicated issues. Leading, I would imagine, from a place of experience. Sounds like your dad, who went through a very personal health issue. What are we doing right, and what are the things that you at Accenture are helping to do better?
Well, let me get started with the challenges that we're facing, and then get what gives us hope, right? And optimism, going back to the prior comment. So first, it's a really tough time for healthcare right now. And the challenges that we are facing as a country are increasing, not decreasing, in terms of healthcare. And that's for a number of reasons. The first is the cost of healthcare in general is rising at the same time that utilization is rising. So folks are getting older, they're needing more services, and so utilization's up. At the same time, the cost of care is up. That challenge is further exacerbated and complicated in that some of our most recent legislation is taking folks and challenging folks in terms of what states and localities are going to do around Medicaid and who they're going to be able to cover. It has also changed some of the overall risk pool in terms of how people can access federally supported healthcare, whether that's through Obamacare or through Medicaid and Medicare. And then in addition to that, some of the other safety nets have also been challenged as well. In particular, things around food and food banks and SNAP and other programs that would be things that we would say, Jermaine, are important from it's important for folks to have coverage. It's important for folks to have wraparound services. It's in order to do preventative medicine and not show up when you urgently need the care at a emergency room, which is also the most expensive form of care, and that at the end of the day, we all end up paying because the costs have to go somewhere. Last challenge in that regard is, in particular, some of the cuts are going to particularly hurt rural communities, and in particular maternal and delivery specialties. And so right now you have both payers as well as providers struggling, and you have broader public health challenged in terms of trying to meet the challenges of play, both in terms of overall dollars for who's on the rolls, but also at the same time trying to get much better at error rates and waste, fraud, and abuse, and a whole variety of other activities that they're undertaking. There's also a movement or an effort afoot around saying, hey, if you are going to get Medicaid, you have to either, and you're considered able to work, you have to go through a process of documenting why you can or can't work through worker requirements and through what's called community engagement. Like if you can't get a private sector paying job, what could you do to be of benefit in the community? And so all that's transpiring and challenging. On the side of kind of hope and optimism, right? Those challenges are now being met with creativity and a spirit of invention and a spirit of kind of like, how do we change this whole thing in a material way that'll make a difference? And you see states doing it, you see localities doing it, you see community-based organizations doing it, you see rural hospitals doing it, trying to figure out like, how do we use technology? How do we use ambient listening to better aid and abet our nurses and our doctors, to get them better leverage, to get them spending more, not less time with patients? What can we do with AI to make claims, to make payments better, faster, cheaper? How can we use AI to come up with new and better medicines and treatments? How can we use it to remind people to stay on their treatment plans? What else can we do in terms of making sure that we are testing the well-being of all of our hospitals, but in particular our rural hospitals, so that financially they can stay solvent? So there's lots of stuff happening, a lot of it technology enabled, that is creative and new and reflective of public-private partnerships that try to change the game in healthcare, that is born of necessity and born of a very challenging time for payers, providers, and public health.
Sure. All right. So with that, I'm going to open it up to the audience. Very complicated issues to have to deal with. Of course, I think you're the right person to handle them. Do we have a mic that we can go around the room?
I am Tisha Heiter of PNC's nonprofit strategy team. And so I'm very curious from the nonprofit side, where you see the current environment, all things considered, about the pressure nonprofits are facing. And I know that there are a lot of board members here and even nonprofit leaders. What do you wish everyone had top of mind as we think about the future of nonprofits and their role in being part of the solution?
So great question, Tisha. It's what I should have said, Jermaine, is all of my clients are struggling at the moment, whether it's healthcare or nonprofits or higher ed or like it's across the board. One of the things I would argue, Tisha, is similar, right? Is that if you look at some of the organizations, especially in the international aid and development community, that have been most severely challenged, they are now looking for new and different ways of creatively rising to that challenge, right? And so if you look at some of the organizations, they're rethinking not just what can I do to diversify my revenue streams, and not just what can I do to look at better back office shared services. They're even having now the courage to say, hey, you know what, maybe if there's 5 of us as international aid and development organizations that are all nonprofits, maybe we don't need each to have our own set of staff in Zimbabwe or our own set of staff in Ghana or whatever the case may be where they're delivering services, and creatively thinking about how they, in effect, go to market and deliver services. And is there a better or more optimal model that they can pursue? And so the one thing I would challenge going to the board members and to the folks working on nonprofits, yes, you have to diversify your revenue streams. Yes, you have to try to make sure that you are balancing costs and revenue and building up rainy day funds and whatever else you can do. And for some folks, especially if you're on the social services side, that's particularly difficult, right? Because your demand for services is rising at the same time the economy is challenged, and those donations may be going in the opposite direction. But all that is stuff that you have to do, but I would also encourage you to think creatively about, okay, well, maybe for this moment, as opposed to the proliferation of more nonprofits, maybe we should be merging. Maybe we should be sharing assets. Maybe we should be doing shared services. Maybe we should, like, all the different types of things you may not have wanted to pursue before, but you might have to pursue now, given the, in some cases, existential threat to the organizations.
Thank you so much. Thank you so much for your story. There are so many connections to work that I do, also at nonprofit theater, with roots in the Jesuit world and at Bernardine. Also, I've done service work in New Mexico. And I grew up outside Italy. So there's this guy about.
Are you sure I'm not relate?
I don't think so. Never know. But I'm curious about more personal journey to go from Gallaudet, Mexico to Harvard Business School. Like, what it was that you were pursuing at Harvard Business School. Very hard place to get into. But what it was about what the work you were doing in Hexport, how that threaded into the business work, how that has informed your journey in years, which is incredible. It's amazing for someone at your stature to say family and health first, will stop. And that must really create the kind of culture that people see. Sorry, it's not groovy.
No. Oh, it's great, and thank you for the question. So first, just when I went to Harvard Business School, it definitely felt like I didn't know where I was and what was going on. But I went there as opposed to law school. Well, first of all, I couldn't do a JD MBA anymore because I'd been out too long and I needed to get a degree. Second, I went there to pivot my career back into business and to use that as a pivot point. And then third, for me, going to Harvard Business School was about fighting a stereotype. There was a stereotype that follows women and people of color that always says, hey, guess what? We don't think you can do the math. We don't think you can do the negotiation. We don't think you can do the analytics. We don't think you can. We don't think you can. We don't think you can. And this was about, in part, saying, you better believe that you can. And so, yes, I went. I still remember my first day there, and I know this is gonna sound like a joke or for stereotype even, but I get on campus. I've been making $300 a month, traveling around in a rickety old bus, using all of my money for gas and eating a Dairy Queen so that I could see all the natural wonders around New Mexico. And I get to Harvard Business School, and my very first thing when I get on campus, there's a guy who needs my help, who's moving into the fancy dorm. I had the worst dorm on campus. No, full stop, like the worst dorm. My dorm was so bad on campus because I didn't have any money. People had to walk through my dorm to get to the bathroom. That's how bad it was. Anyway, that's a whole nother story. But anyway, I get there, right? And this guy is unloading a piece of teak wood furniture out of the back of his Porsche to take up
into the beautiful high-rise apartment complex that is on campus, that not where I'm staying. And I'm like, oh sure, I'll help you, no worries. So I go to help this guy, and I meet him and his wife Victoria, and we meet and we go up, da 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 da. And I go to class the next day, and he's in my section. And so I'm thinking, wow, this is like, his family is part of the founding of Harvard, and Sean Winthrop had him the third, or David, right? Yeah. But that was my journey. I was like, where the hell am I? But all that to say was, I wanted to make sure that I had all the analytical skills and frameworks, and it was important because I had already done Capitol Hill, not do Kennedy School, but instead do the business school, even though more of my people were at the Kennedy School. And key thing about Accenture and why I've stayed so long is I've been able to do for-profit, nonprofit, and government while advancing service at Accenture. So all four of those things have been part of my journey throughout my journey at Accenture.
Hey, Marty, thank you. Really appreciated how you laid out all of the pressures that healthcare is facing right now, and you pretty much succinctly did it in less than 5 minutes for 7 days with. And you also mentioned that many of the things that we're doing right now is technological innovation, so that's going on. With that, based on what I've heard, you're a very people-centric person. And knowing that as we start to advance in technology, that's going to impact our people, particularly this region where the healthcare workforce is such a large part of the region. What are your thoughts on balancing that technology with the people factor, where perhaps even some of the lower level healthcare workers may work the testosterone away?
So great question. A few things. First of all, as leaders in this room, I'm going to come back to your question. As leaders in this room, we have to be talking about AI as AI and technology, digital, whatever you want to call it, all has to be, we have to have humans in the lead and humans in the loop, and you can't just think that AI is going to do and solve everything. We believe net that AI will create more jobs than it eliminates. But the question is jobs for whom and when? And what are we doing in the DC region and beyond to get our folks skilled, upskilled, reskilled to be ready for those jobs, and to be ready for the careers that those jobs will require, and the ebbs and the flows that will come from that. In terms of, you mentioned kind of the concern of workers and concern of folks in general, but in particular in healthcare. A few things in that regard. First, part of the reason that everyone is so concerned about AI and jobs is because how we as leaders are talking about it, right? Everything we talk about is cost efficiency, is, hey, I'm going to replace you with an agent, right? And all of the language that we use, it's never about growth. It's never about learning. It's never about development. It's never about making our people better, making our people enjoy their jobs even more, right? And one of the things I would contend, especially in healthcare, is we actually have the opportunity, especially with things like ambient listening for doctors and nurses. We have, part of the reason healthcare is going up, folks, is we have a critical, and I mean critical, shortage of doctors and nurses in this country. And our inability to do what we need to from an immigration standpoint around doctors and nurses only further exacerbates that. And so in this moment, we need things like ambient listening to free up their time so they're not spending all their time doing notes and doing orders, and enable them to do that administrivia with a lot less time and more time focused on patients and caregiving. And when they do that, the outcomes for those patients dramatically rises. And so what I'm optimistic about from a technology standpoint is not that it will take out workers. It will actually hopefully repurpose workers to do more healthcare, better healthcare, and higher quality healthcare that will lead to better outcomes. And that has to be our aspiration. And as leaders in this room, if your folks are out there in your businesses or in your nonprofits and they're talking about AI, and they're talking about it as, hey, here's our AI strategy, and they're not also talking about your talent strategy, and ask them to think again.
So one more question.
Hey Marty, like with some of the others, thank you so much for being here, speaking to this group. Really appreciate hearing your story, especially the origin story, the incredible pride to take their lineage, how you got here, how you applied some of those lessons to your leadership. So thank you for sharing that, very inspiring. My question is, going back to something Jermaine mentioned earlier as you talked about your career trajectory. My timeline is adding up. You've probably been at Anderson a few years when the whole industry hit an inflection point around the early 2000s, Enron, those kinds of things. Can you talk about some of the leadership lessons you learned and applied then, as there was a metamorphosis from Anderson to Accenture, and how they were able to help grow them from very perilous time, if I recall correct? Do you want to talk to me about that a little bit?
Sure. One, the Anderson Consulting was part of an organization under a holding company called Arthur Anderson. It was both an accounting and a consulting firm, two separate firms. What occurred was there was Enron, and then there was a couple of other smaller organizations of either churches and other nonprofits. And all of that hit Arthur Anderson at the same time. And as a result of that, there were challenges around integrity, let's call it, under that broad rubric. And as a result of that, Arthur Anderson went under. And at the time, there was Arthur Anderson and Anderson Consulting. That was right when I joined the firm. And I was like, what the heck is going on? Like, all these folks were debating back and forth. They were trying to separate the two parts of the company. And eventually the International Arbiter decided, hey, we should separate these two companies. And at the time, Anderson Consulting was upset because they didn't have right to the brand name, because it was on the balance sheet, the goodwill of Arthur Anderson. And the partners were upset, even though they got what they wanted, which was to separate and divorce the two companies. Once that occurred, shortly thereafter is when Enron hit. And if we had had the same brand name versus the new name that somebody from, I think as a kid from Australia came up with, accent on the future, Accenture, accent on the future, Accenture, we would have gone under too. So sometimes it really is better to be lucky than good, because nobody wanted any name. We just had to get one, and it saved our company. And the other thing that allowed us to do, which I think is the most important, is we decided to go public. And there's not, as you're probably aware, there's not a lot of publicly traded consulting firms. And that decision made a material difference in our ability to grow, to invest in our people, to invest in assets, solutions, products, and services, and to double down on the ability to bring the best talent to our workforce and to serve our clients in unique ways. And so that, I think, was the primary thing that changed how we went to market, and is one of our key competitive differentiations as we go forward in terms of our ability to partner with all the leading tech firms in the world, all the new leading AI firms in the world, and to do it in a way that is reflective of what they have to do every quarter. So,
Marty, thank you very much for a great conversation. Really appreciate it. Very quickly. You've got a question, Marty. Are you going to the Notre Dame Villanova game in Rome with the Pope?
I'm working on it. There's a huge debate right now in our circles as to going with it. So there's two games, one men's basketball, one women's basketball. There's a huge debate about going to Rome for that game, or that same week is the Miami Notre Dame football game on campus. And so we probably can't do both. And so the question becomes of lunch.
We also have another very fun LWLE Notre Dame award John Beamar is former chair of LGW. So
He is the chair. He trained well because he's now the sheriff's secretary. And he told me he's going to Rome. So there you go.
He probably doesn't have a choice.
Everybody, thank you very much. I hope Marty gave a great meeting. And you all to come to our summit on June 24th at MLK Library. There is a people-first approach to AI. Okay, that's the topic, the theme for the whole day. Thank you very much, Jermaine. Thank you again. Great day. Have a great day, everybody. Thank you.